MS can affect many aspects of a person's life, both physically and emotionally. And in order to effectively meet the needs of all of these challenges, the MS Clinic of Central Texas offers MS patients access to a unique medical clinic that consolidates MS-specific services all in one place. One of the goals of this MS clinic is to maintain and improve current functional limitations, prevent further problems, and to provide compassionate, comprehensive care to MS patients, and I'm very happy to be a part of that.
I'm Edward Fox, MD, PhD. I'm the director of the MS Clinic of Central Texas. And this is my office. It's part of a larger building where we have 4 doctors who see patients for all different neurologic diseases. But my specialty is multiple sclerosis. When a patient's newly diagnosed with multiple sclerosis, it's so nice to have the information from the National Multiple Sclerosis Society to help explain to them the nature of the disease. It's also very helpful to have social work and support groups and all of the access to the help that the patients need. So when I give them this information from the MS Society, they can go home with something to help explain the situation to their family, friends, co-workers, and then when they come back in, they're armed with much more information and better types of questions for me. Whether a patient's newly diagnosed with multiple sclerosis or has had it for a number of years, there's always room for improvement in their fitness level. So I'm very excited to be working with the National Multiple Sclerosis Society and working on total fitness, exercise programs, physical therapy, and wellness programs. Fortunately, there are new therapeutic options for the treatment of multiple sclerosis. That's why this clinic has developed an infusion suite. This has these chairs that have been designed for patients to be able to sit in while receiving intravenous medications. It's also very useful for clinical research. We're involved in a number of clinical trials right now which require IV medications, and so this is the perfect setup in order to be able to do this clinical research. Having an on-site pharmacy has been very helpful for us. We've been able to do a lot of clinical research by using this pharmacy, and having it right next to our office means that if there's a problem with the patient's infusion, I'm right here to be able to interact with the patient and see what's going on.
We are involved in about 20 clinical trials, testing IV medications, oral medications, and also testing injectable medications. As a result of these studies, we have accomplished FDA approval for several of the therapies that are on the market today. Much of the research that we do here at the clinic wouldn't be possible without the support of the MS Society.
The MS Clinic of Central Texas is part of a general neurology practice. There are 4 doctors in the group, and the other 3 doctors do things other than multiple sclerosis. I'm very, very blessed to have a group of people who support me in being able to have a specialty MS clinic. So at the same time that I have partners doing EEGs and other tests for other neurologic conditions, I can concentrate my time on the treatment, education, and research of multiple sclerosis.